typical scene for a mom.
He's really funny. He laughs at everything.
But the path to this playdate was anything but typical. Jalissa says she had severe anemia, kidney problems, and an autoimmune disease.
My body fights itself a lot, so that causes a lot of pain.
And that pain has prompted doctors to prescribe drugs like morphine and oxycodone.
Because Sincere went to the NICU, they test all of the babies for every single substance that you can think of, and my medication showed up in his system.
By state law, the hospital is required to report that finding to the Department of Family and Children's Services. But there is nothing in the law that required the hospital to conduct that test in the first place. Once alerted, though, it is up to DFACS to decide how to respond. Since the parents had a child welfare case from more than a decade ago, it chose to take Sincere into protective custody. The same thing happened 2 years earlier with their daughter, even though, according to medical records provided by Jalissa, she spent almost her entire known pregnancy in the hospital.
If a newborn was found with cocaine, methamphetamine or something, I would 100% get it. And I have a lot of history at that hospital. They could easily go back in my records and see that all of my medications have been prescribed.
Jalissa's children were born at Northside. The hospital wouldn't answer any of our questions about its testing policy, calling it a complex area of medicine. In fact, of the 5 metro hospital systems we surveyed, only Northeast Georgia Medical Center would detail its testing policy.
It's an area where there's a complete lack of clarity.
Pediatrician Stephen Patrick, who also serves as professor and chair of Emory's Health Policy Management, says drug testing increased in 2016 when the federal government, still trying to crack down on the epidemic of drug-addicted babies, mandated reporting of any child affected by drugs, illegal or legal.
The intent was to connect caregivers to treatment, to provide wraparound services to infants.
The federal law only requires a hospital report a child that is affected or experiencing withdrawal from a substance. It is Georgia that goes a step further, mandating it report even a baby's positive drug test.
What the language says is substance affected, and that doesn't have any clinical meaning whatsoever. So it's open to interpretation, either by a state or by a clinician.
According to data provided through an open records request, Georgia hospitals reported nearly 3,500 drug-affected newborns in 2020. Since then, DFACS says better education around reporting has steadily cut that number in half. But 11 Alive News Investigates discovered nearly 2/3 of those reports are eventually unsubstantiated. That could include a mother who used THC gummies or marijuana to manage pregnancy pain or nausea.
It's not serving people with substance use disorder well. It's not serving their infants well. It's not serving the people that are caught up with false positive tests, which we know happen.
If the cases like Jalissa's substantiated in the eyes of DFACS, roughly half lose custody, at least temporarily. Jalissa and her husband waited nearly a year before the Gwinnett County judge over Sincere's case ruled the state failed to prove their son was in danger. In September, Jalissa took another drug test, which came back negative, hoping to prove there is no reason she shouldn't get her daughter back too. How do your health problems impact your ability to be a mom?
They don't.
And she believes it is unfair her medical conditions were ever used against her. She and her husband are grateful they now get to enjoy this 4-toothed early riser.
Oh, he gets up 5:30 like he has a job to go to.
Learn his favorite foods.
Bananas and beef.
And treasure the typical moments so many parents take for granted.
We hug, I give him kisses, he kisses me back, and we play. That is really it. That is my focus right now.
In Gwinnett County, Rebecca Lindstrom, 11 Alive News, investigates.
If you have a tip for Rebecca or our investigative team, you can reach us by emailing investigates@11alive.com.